Hi guys, my name is Sammie Gallo and I am the youth coordinator for Anglicans for Life, and I'm excited you're joining us for another week of Truth versus Lies. An ectopic pregnancy is also known as a tubule or extrauterine pregnancy, and these actually occur when the newly conceived human implants somewhere else than the uterus. Most commonly, these happen in the fallopian tubes. The proper process is for cilia, which are like little fibers in the fallopian tubes, to move the offspring, called a blastocyte, at this stage to the lining of the uterus for implantation, either for reasons unknown or due to hormonal interference like birth control or Plan B, which can actually slow the movement of those cilia, of the little fibers. The blastocyte may be impeded, causing it to implant elsewhere and resulting in an ectopic pregnancy. These type of pregnancies are extremely serious. In the female body, only the uterus was actually designed by God to successfully house and nourish a growing human being. If that new child implants somewhere else, his or her growth will invariably lead to dire complications, such as a bursting fallopian tube or internal bleeding. These are all the genuine life of the mother cases that you hear about. This is also a good place to note that even pro-life OBGYNs recognize ectopic pregnancies as being non-viable because any environment besides the uterus is lethal to a baby. Therefore, the mother's life is always the priority of treatment and care in these situations. So let's take a moment and talk about how ectopic pregnancies are handled. Tragically, like I mentioned before, an ectopic pregnancy is a death sentence for an improperly implanted child, at least with our current technology. Once implanted, a child cannot be safely relocated, nor can they successfully grow to term outside of the uterus. Thus, the procedures carried out in these circumstances are done solely with the mother's safety in mind. There are several common treatments, and I'm going to go over two of them today to kind of help you understand what modern medicine does to help women in situations concerning ectopic pregnancies. First, methotrexate is a powerful drug that is commonly used in cancers and in the treatment of rheumatoid arthritis, but it also can be used as an abortion drug because it is toxic to the trophoblastic tissue, which is actually, remember, the blastocyte that we talked about that is moved along by the cilia in the tubes. It's toxic to the outer layer of that tissue, so it will actually destroy necessary nutrients that are needed to develop a human. Secondly, surgery is used. This is takes the form of a salpingostomy or salpinectomy. The former procedure involves incising a hole into the fallopian tube and removing the blastocyte or the embryo. The latter involves removing an entire section of that fallopian tube where the new human was implanted. Now, consistent pro-life advocates find it compelling that there is only one treatment for ectopic pregnancy that cannot directly kill the blastocyte or the embryo, and this would be the salpinectomy, the surgery. As the American Association of Pro-Life Obstetricians and Gynecologists points out, in most cases, the embryo has already passed away by the time an ectopic pregnancy is discovered. Remember, any environment other than the uterus is lethal for an implanted embryo or unborn baby. Many argue that the surgical route is the most morally permissible avenue in a tragic situation because the procedure is done with the intent of saving the mother from the problem, a fallopian tube that is likely to burst, as opposed to the intent to kill the child. Intent matters. And that's something we always need to be aware of as we talk about this complex and heartbreaking issue. One of the big fibs peddled by abortion friendly outlets is that natural tragedies like miscarriage and ectopic pregnancy treatment are jeopardized by pro life laws. In a large chunk of cases, we feel this is an ingenuine and simply an effort to distract from abortion itself. But in the case of a pro choice position with genuine concern about women in these situations, the mainstream pro life position is clear. Miscarriage is not the same as abortion. Effective ectopic pregnancy care does not entail the intentional killing of a baby. Remember, intent matters because the baby is not in a viable environment in the first place. Both sides should be working together to find the best ways to treat all parties with dignity and respect when tragedy strikes. But that cannot begin until abortion supporters cease using exception cases like these to justify all elective abortion and their corresponding laws.